I'm Vanessa Mashanya. At the beginning of last year, I spoke to teachers and students and school administrators about their concerns over this current school year, about how the mental health crisis in youth is too great and the amount of resources available to students is just not enough. Well, according to some new numbers, it seems as though their concerns have been validated.
Teens who spent any time in high school during the pandemic can tell you they most likely had to grow up a little more quickly than we had to when we were their age.
Around this time, I had a friend to commit suicide. I'm sorry. I get emotional when I tell this story. Still looking for closure, still wondering why. How did I not know? Why didn't she call?
Isabella Coyle just graduated, but her experience has left scars.
I've been through depression, suicide thoughts. Thank God that I got through it, because I would not be here today had it not been for my mom. But I told her about it. You know, it's kind of hard. How do you tell your mom that you don't want to live anymore?
Izzy opened up to me about the toughest years of her life while at NAMI, Mississippi, where she volunteers. Because even though she's dealing with a lot, she knows connections are what help those in need.
Trying to reach out to all my other friends, hey, are you okay? Do you need to talk about it? Is there anything I can do?
It's just a lot that our young adults are needing in terms of mental health, and it's not necessarily there.
Sataniel Wimbley is the executive director of NAMI, Mississippi, which provides mental health help and conversations for young adults. She says Izzy is one of the lucky ones who was able to find help, even though it is getting increasingly harder to do.
The school systems don't necessarily have the funding to help the way it's needed, but they're doing what they can.
According to numbers released in December by Effective School Solutions, an organization that provides mental health assistance to schools, many school administrators say the mental health problem in schools is getting worse. 36% of both urban and suburban schools say students' mental health is worse now than it was in 2021. 55% of rural schools say the same. And while 40% of school administrators say they are confident in their district's ability to handle the need, only 16% of parents agree. However, the top concern of both parents and school staff, identifying the needs of students and having enough staff to support them. Izzy says she wishes better systems were in place before she lost her friend.
Principals, the teacher, they started putting up, suicide hotlines. If you need to talk to anyone, I'm like, why wait till the last minute? Why wait till someone's driven to suicide to reach out to other people who feel like they're driven to suicide?
The lack of resources is a national problem. The National Association of School Psychologists say only 8% of school districts meet the recommendation of one psychologist per 500 students. And only 26% of schools meet the American Association of School Counselors recommendation of one counselor per 250 students.
Then on the other side, if you're trying to get private help for your child, there's waiting lists. And then there's insurance problems.
Sataniel says parents who might be left without resources can call or text the new 988 Suicide and Crisis Lifeline, even if it's not an emergency. The call takers are able to point parents in the right direction in terms of resources. Regardless of what will happen in schools, both Sataniel and Izzy say now is the time to have open conversations and to ask questions.
Pay attention to the young adults, listen to their voices, and understand it's okay not to be okay.
Vanessa Mashanya, Scripps News, Jackson, Mississippi.
5 months after its launch, the nation's new free mental health crisis hotline is more active than ever. Hear what life is like for the people answering the calls. You're watching The Race.